Hi, my name is Kate Rouse, and this is my population level health education intervention project for Nursing 445 at CSU San Marcos. So introduction, the two health-related problems that were identified among the community through my windshield survey and meeting with my stakeholders in the community and just spending time in the community were a diabetes risk and nutrition and weight status. So some background and significance of those topics. The windshield survey and the stakeholders revealed that there's little access to healthy foods in the area. It also revealed many unhealthy lifestyle choices through little physical activity, no one doing physical activity at any of the parks, nothing like that, only real walking was for a purpose. The many fast food restaurants on every corner, lack of healthy grocery stores, and much of the population in general being overweight and unhealthy. The demographics themselves also revealed an increased risk of diabetes in the fact that the majority of the population is Hispanic at 71.1% of the population. Healthy People 2020 actually reports that people from minority populations are more likely to be affected by type 2 diabetes. And minority groups consist of 25% of all adult patients with diabetes in the United States and represent the majority of children and adolescents with type 2 diabetes. So this shows that this population is at increased risk of developing diabetes. Also, Bobby, one of the key stakeholders, identified that these families barely have enough money to survive, and they're feeding their kids the cheapest processed food they can find and have no understanding of good nutrition. So this was another way that I identified that nutrition is a big need in this community. It also allowed me to identify the significance and importance behind addressing these identified health problems. So Healthy People 2020 goals and objectives that were specific to the needs that I identified of the community, and that would be nutrition, weight status, and diabetes. So nutrition and weight status, the goal is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. So these objectives include increase the number of members of the population that are at a healthy weight and decrease food insecurities among the families. And then diabetes kind of goes hand in hand with nutrition. The goal is to reduce the disease burden of diabetes and improve the quality of life for all persons who have or who are at risk for diabetes, which we have identified that this community has a higher risk. So the objectives are reducing the number of newly diagnosed members of the population and reducing the death rate from diabetes. So needs assessment. So this is the way that I was able to identify the needs in the community. So this was through observation during my windshield survey. So like I said, as I drove through the community, I could see people that were overweight and engaging in unhealthy behaviors and activities such as eating at fast food restaurants and driving instead of walking, and just the overall lifestyle through driving in the community. And then interviewing the members of the population, so that those are people that live in the population. I have an interesting perspective on the community in that I am an ER nurse in that community, so I actually have a lot of interaction with these members of the population. So through interviewing the ones at my project site, I was able to identify, what the needs are of the community, what they want to learn, and how they want to improve. And also the key stakeholders, I was able to interview them and get their insight on what they thought the community needed, and then just research of the community in general. So those websites, the census websites, to be able to see, what the major problems are in the population, the demographics of the population, all that helped me to identify the overall needs. So the theoretical framework and model that was utilized throughout this project was the pre-seed proceed project. So phase one was social assessment. So that was defining the ultimate outcome of the project. So it identified specific needs and determined the priorities of the population. So in phase one, basically I looked at what could improve their quality of life. How could I intervene? So some of the things that came up for this community specifically was gang violence, chronic illness, the public health infrastructure issues, and then basically it came to what I could actually help improve, and that was identified as the nutrition and diabetes. ultimately that's what I could have an impact and an effect on. So in phase 2, that is your epidemiologic, your behavioral and environmental assessments. That's identifying the issues in the community. So their lifestyles, their behaviors, and environmental analysis. So through this, I was able to look at the behaviors of the community. There was little participation in recreational activities in general, let alone health-seeking behavior. Determining the reasoning behind those was one of the focuses of this phase. So some of the community members identified that just the lifestyle of the community plays a huge factor. So that's primarily, the Mexican culture. So that's going to be primarily Mexican foods consisting of, rice and beans as well as processed foods. These families don't have a very good knowledge base on proper nutrition. So the youth that are the ones that I intervened with, they don't have a good knowledge base due to their family not having a good knowledge base. So family plays a big factor in that. And then the cultural influences, like I talked about, and the physical environment as well. So the low socioeconomic level of population impacts their ability to succeed in these health-seeking activities. So just that there are, poor living conditions and lack of resources overall. So those were important to identify. And then the poor access to healthy foods or healthy food choices, which contributes to the high obesity rate, diabetes, more chronic illness in the community in general. So phase 3 is the educational and ecologic assessment. So that examines the factors that influence behaviors, lifestyle, and responses to the environment in general. So those are your predisposing, your enabling, and reinforcing factors. So some of those that were identified were the knowledge deficit. So like I talked about, a lot of the families don't have general, knowledge of healthy behaviors and nutrition. Let's see. And then attitudes that are reluctant to change. So a lot of them they don't see a problem with the way they eat or a problem with the way they manage their diabetes in general. So conflicting beliefs and values as well. So that goes into your cultural, those are the foods that they, culturally are important to them. So that's difficult to tell them to eat something else. And then just lack of confidence in the ability to change. So this is the way they've done it. Why would they do it any differently? So one of the biggest things too that I identified was that only 57.3% of the population graduate high school and only 9% have obtained a bachelor's degree. So this just shows lack of formal education and the potential for a knowledge deficit in health promoting behaviors, because they may not be able to even have the knowledge or even be able to understand if someone provides that information to them. And then like we talked about culture, and that's pretty much it for phase 3. So phase 4 is an administrative and policy assessment. So that was me analyzing where am I going to do my intervention projects and analyze the support at that organization, and then just overall in the community policy and how politics play a part in this, in these two issues. So barriers that may arise from that would just be lack of interest in community members. This may not be a priority to them. What was identified as a big priority in policy and administrative wise was gang violence rather than the overall health. So it was more focused on safety, which is a priority, definitely, but it would just warrant less buy-in to the nutrition and diabetes aspect of it. Another thing is lack of organizational participation. So I contacted the community center with my key stakeholder, and they seemed to have some hesitation to participate in these intervention classes. And then just overall culture of the community. So little buy-in to the need for change for nutrition and diabetes. So phase 5 came down to the implementation of these interventions, which were the 2 nutrition classes. So through all my research, I was able to better implement these classes and identify, the needs of the community and how I was going to go about doing this. So I was able to identify key stakeholders that had a location for me to work with a specific population, which was adolescents of the community. So that was at the Abel Maldonado Center. And he was able to with some difficulty, allow me to utilize one of the classrooms of the community center to provide my intervention project. So I provided 2 different classes. There was no PowerPoint, no video, no electronics. So most of my stuff was primarily handouts, verbal, auditory learners, appealed to the auditory learners, and then some interactive games such as Jeopardy or pop quizzes for some prizes. Let's see here. So next was phase 6, which is the process evaluation. For this phase, I identify goals for planning for my own self and for the key stakeholder. So nutrition, it was by November 15th, 2016. A date for the nutrition class will be scheduled with the key stakeholder. The next one was diabetes. So by November 15th, the same date, the objectives of the diabetes class will be identified with the key stakeholder. So those were difficult in obtaining the date due to some of the barriers that I'd talk about with the project site. So next is phase 7. So that's impact evaluation. So that's identifying the appropriate goals and outcomes for each of the classes. So some of those were the nutrition class goals. After attending a 1-hour nutrition class, members of the community will verbalize a better understanding of nutrition and identify positive changes feasible to make in their own lives. And the diabetes class is after attending a 1-hour diabetes prevention class, members of the community will identify 3 risk factors for diabetes, 1 lifestyle change they'll make to reduce their risk, and where to obtain screening in their community. And then lastly was phase 8. So that's outcome evaluation. That's something we won't be able to fully evaluate. However, I was able to come up with some long-term goals. So for the nutrition class, it's reduce the number of preventable conditions from poor nutrition in the community through the promotion of healthy eating. And then in diabetes, it's reduce the risk of diabetes development in the community through an increase in prevention behaviors. So issues with education and practice. So some of the barriers to change was the buy-in and the motivation. So the community was very hesitant to allow me to come in and to implement these classes. Accessibility to resources. So where I was going to be able to do that was definitely difficult. I had to evaluate a couple different sites and figure out what is going to be the most effective and how can I reach out to the most amount of people. And then self-confidence and abilities. So their self-confidence is very limited in that they do not feel that they are capable to change. So that was definitely a barrier for me to help overcome. And then the resources needed for change for these people is just an overall knowledge. So again, that lack of formal education also plays sort of a negative or barrier, I should say, to just gaining that knowledge and taking in that knowledge. And the financial resources, so the ability to purchase healthy foods and nutrition, or even purchase proper equipment for diabetes management as well is also hard. And so that's, again, goes into your access to health screening too in the community, and accessibility to healthy food. So those affect both nutrition and diabetes and the community's ability to be successful. So intervention was the actual intervention that took place. So this is my specific objectives of each of the classes. So nutritional objectives are, as you can see, or increase the number of, the goal would be increase the number of members of the population that are at a healthy weight and decrease food insecurities among families. So that comes from Healthy People 2020. So the nutrition class offered information on the importance of proper nutrition, tools to healthy eating, recommended caloric intake, and how to access healthy foods in the community. So I was giving them the tools to be able to be successful, to maintain a healthy weight, and to obtain healthy foods in their community. So diabetes objective was reducing the number of newly diagnosed members of the population and reducing the death rates from diabetes. Again, that's from Healthy People 2020. So the diabetes class specifically offered information on risk reduction, as well as management and reduction of the complications of the disease. So them learning about all that and providing them the knowledge and the tools to that. So the intervention classes are aimed to meet these objectives, and the classes offered information pertinent to the specific population. And then I used handouts, visual aids, as well as different activities such as Jeopardy and games to reinforce the learning. So budget and logistics for me. So organizational the organization itself was difficult to coordinate with, to try and figure out, whether I could use a classroom, whether I could do this. So there were some struggles in the logistics of it. Difficulty obtaining classroom, like I mentioned. Money to purchase the diabetes testing materials is another thing. So that, again, is just in the budget. I was able to get some sample materials from the hospital to donate to the community. And then no access to PowerPoint or electronics for the class. So that was another logistical thing. How am I going to present this information? What's the best way for them to obtain this information and be able to utilize it? And then English and Spanish resources for the families as well. And then cost of teaching materials in general. So handouts, food samples, things like that. So I did have to utilize some of my own financial resources to support this project. So project evaluation, design, outcome measurements. So here you can see the short-term objectives. And then for both the nutrition and diabetes classes. And then basically the evaluation of these short-term objectives, were the objectives met and the goals obtained? So basically if each of these were met and whether the outcome of the nutrition class resulted in these goals, as you can see. So then we'll talk about our long-term. So this is for both classes. So nutrition is, like we talked about, reduce the number of preventable conditions from poor nutrition in the community through promotion of healthy eating, and then reduce the risk of diabetes development in the community through an increase in prevention behaviors. So there's how I would evaluate. So the initial one for nutrition would be evaluation of the health data, and diabetes could be through a survey of their behaviors. So results and conclusions can be difficult to determine the needs of the populations. There are many needs that can be addressed. Difficult to pick what's important and how you're going to do it. Can be difficult to engage stakeholders and must have motivation to be successful. Organization barriers can sometimes be difficult as well, like I talked about, difficulty to get the organization to buy in. And it's actually as difficult to measure outcomes for health promotion, and sustaining behavioral change proves to be difficult as well. So this is a picture of me implementing one of my classes. And there's my references. Overall, I think this was an awesome assignment to be able to identify the needs of the community and help make a difference and intervene and look at the impact that I can have among the community. The students that I did my presentation with were very receptive and excited about the new changes that are potential in their community. Thank you. And these references are from the entire project themselves in the research planning as well.